I'm Ja. I am the Research and Innovation Hack at Shamiri Institute. And I have been kind of the donation lead, I guess, working together with our sponsor, Alchemy Pay, and also our research team to best facilitate this wearable study. The values Shamiri Institute share with Alchemy Pay is mostly in its grassroots nature. As we know that Alchemy Pay, our sponsor, is a blockchain technology company, and blockchain itself is a decentralized technology and very democratic, and allows people to transact anonymously and also in a democratic way. So I think that really echoes with our grassroots nature. We are a youth-led organization trying to research the most affordable mental health intervention for the sub-Saharan African youth.
My name's Natalie. I'm the research manager for Shamiri. So I'm in charge of, making research studies happen that other people dream up and bringing it to the field and bringing it here to our participants. In this particular study, I was responsible for implementing all the measures and following up with all the participants.
Yeah, I realize it's the first time smartwatches are being used for research in Kenya, and I'm really looking forward to see the results that will come. And I think it's something that is very nice, especially bearing in mind that those smartwatches, the participants will wear them. So other than the physical measures that we're used to taking as clinicians, now these ones will take them from the smartwatch. We'll extract that data from the smartwatch itself. And so we know that the data will be accurate.
Mostly one of them was one of the most affordable brands, but at the same time, it was quite easy to use. We had a demonstration compared with another brand. We just realized that Xiaomi was a little bit more easy to use and very simple, so it will not require a lot of technicalities.
In the case of the Xiaomi bands, it was very fast when we decided to use the bands. Between when we decided to use the bands and when we were starting data collection was about a month. So we had to find someone who had the actual bands in Kenya already. And we also had to find someone who, they were in a certain price point. And also, where we could possibly even get the API server from the back end to get the database from all the watches that we have.
With relation to the smartwatches, one of the main challenges that we had was that data could not be collected or stored in the watch if the watch was not paired to an external device, such as a smartphone or a tablet. And what we found after administering or giving the smartwatches out to the students, we left it with them over the period of 2 weeks. And in that time, several students unpaired their watches accidentally.
And that would take us back in terms of collecting the data that we need for our study.
Sometimes we don't even know if they're the ones wearing the bands, and actually we haven't set up a way to find out if they are the ones wearing the bands, besides just telling them that they should be the only ones wearing the bands. And I would say the third challenge would be also related to IT and tech, which would be just like actually getting the watches ready to go and like setting up the account for the kids and making sure that it still logs in, like little things like this. But it's so important, because if we can't log into their Xiaomi account, then we can't access their data.
Potential impact is quite large, because I think we're one of the first researchers who have used this biomarker, especially in sub-Saharan Africa population. So I think the results from this study would fit into literature that has previously not been studied before.
For me, from my point of view, the impact of the study is twofold. One is on Shamiri Institute and the other is on the broader scientific community. So for Shamiri's intervention, we've done 3 randomized controlled trials in the past, and this measure will be used, the measures from the wearables, to follow our participants in the long term for evaluating our character strength interventions.
On the broader field of psychology, I think there would be enormous implications for this study. The primary one being that it would give us inferences that the Shamiri intervention and low-cost, stigma-free interventions could be scaled up in low-income countries all over the world. And lastly, in terms of the impact of the study on social sciences, I would say this would be an indicator of how reliable technology is in articulating mental health outcomes among people.
Nonprofits should be working more closely with those in the blockchain industry because, even us, we received this donation through the, crypto account. And for example, I have a crypto account and I wish I could use it for more things like donating or even receiving payments, but it's our first time receiving through such technology.
Shamiri Institute are planning on receiving more crypto donation. We implemented a website widget on our donation page, and from now on, we are able to accept donation of any size via cryptocurrency. And then the cool thing is we're partnering actually with Alchemy Pay going forward because Alchemy Pay has a very low fee structure and can handle transaction up to $1 million in fiat currency value. So I think it will be a really interesting collaboration going forward as well.